Right, yeah. So we're speaking about pelvic girdle pain. I've brought this up quite a lot, so I probably should speak about it. So PGP, it's sometimes called, and during pregnancy, you know, one of the changes that can cause pain and discomfort is pelvic girdle pain, and it affects about 80% of pregnant women. I don't know if you guys experienced it. I didn't get too much. I, you know, felt sore sometimes, but it wasn't something that was a big thing in my life. But being aware of this is quite important. So the pain might have an impact on their daily activities, and it might lead to a chronic condition later. So it's about, and I would say from working with a lot of, one of my friends is a psychiatrist who refers some of her, who before COVID used to refer some of her patients to me to one-to-ones, because with their chronic pain they were going to her, it was turning out that, you know, working, and I was working with them for their chronic pain, it really starts to become apparent that some of the chronic illnesses and chronic pain, it comes from emotional trauma as well. So you don't really, you want to be able to nurture and support your students so they don't have issues or problems later on, and to make to be able to hold their space so that their birthing process, you're preparing them for birth, and then after they've had the babies, you're nurturing and holding their space and allowing them to come back into finding themselves again. So by enabling them and empowering them with the tools of yoga, it might help you with lessen the trauma aspect, because sometimes labor can be quite traumatic, and you know, the whole, you know, there's so many different changes and experiences, and you just want them to feel safe and held as much as you can. So what is pelvic girdle pain? So it's one of the largest bones of the skeleton, where the hip bones are situated, and the pubic symphysis adjoins them at the front, and there's the two sacroiliac joints that link at the back. So there's a strong network of ligaments surrounding these joints that keep the bones intact. So, you know, so you've got the pelvic girdle. So I've got my pelvis here, but you guys are aware of what pelvis looks like. So I don't feel I need to get my pelvis out again. So pelvic girdle pain refers to pain anywhere from the front of the pelvis to the back, buttocks, or down the leg, groin, lower abdomen, inner thigh, and the vaginal area. So the pain can be mild to severe, and severe pain might limit your mobility. So it may begin anytime during pregnancy or when you're nearing labor, and it can also develop after labor as well, after delivery. Okay, so when does PGP develop in pregnancy? So you might feel the pain during early pregnancy or first trimester, or a few days before labor. There might be pain and discomfort in the later stages of pregnancy as the baby moves down into the pelvic region. I know that a lot of women get that pain because their baby's lying on nerves. So you might also feel the pain during the postpartum period. So what causes it? So the primary cause of pelvic girdle pain, easy for me to say, is the low positioning of the fetus in the pelvic region. So the increasing size of the fetus puts pressure on the pelvic bones, the joints, and the ligaments, and it leads to discomfort. However, the pain might increase due to a combination of factors such as uneven movements of the pelvic joints, changes in the way the pelvic muscles work to support the girdle, abnormal functioning of one pelvic joint which stresses the other joints, increasing weight, changes in the center of gravity as the fetus grows, pregnancy hormones affect the connective tissues, prior trauma or injury to the pelvic region, repetitive or strenuous physical activities, or exercise routines that strain the pelvic movements, or the position of the fetus putting pressure on the pelvic area, a history of lower back or pelvic pain, or a physically demanding work routine. So how do you know if it's PGP and not something else? So the location and severity of pain vary from woman to woman, and the pain can only be on one side or moving from one side to another, or it could be a general ache or a shoot up suddenly and disappear. So the common signs and symptoms include pain in the lower back, the hips, the knees, the groin, the pubic region, the thighs. It could be grinding or clicking in the pelvic region. So pain is noticeable during movements such as walking on rough surfaces or long distances, climbing stairs, sitting or standing for a long time, moving your knees while getting in and out of a car or the bath, lying on the bed in some positions, and sometimes sex as well. So pain might increase at night if you're active through the day, and symptoms may aggravate with the increasing weight of the baby and the change in the center of gravity. So it occurs due to the relaxin hormone, which usually softens the ligaments and allows the pelvis to widen and make room for the baby. So, treatment for the pelvic girdle pain during pregnancy, it's treatable, but it's about avoiding movements that aggravate the pain and doing exercises that can help relieve the pain and help you move comfortably. So there's warm baths and acupuncture and pelvic support belts, as I said, they're great, but we're going to speak about, we don't need to know about that so much because we're not going to be around our students when they're not practicing yoga so much with us. So let's look at poses, yoga postures that can help relieve pelvic girdle pain. That's what we want to know. Okay, so stretching and strengthening the muscles of your lower back, your hips, and your quads can help. So Setu Bandhasana, the bridge pose, so dynamically, so lifting your hips up by squeezing the pelvic floor and breathing out and remaining for 2 to 3 seconds and then lowering the hips. So that's a great one. So dynamic Setu Bandhasana is a great one for helping with PGP. And hip lifts as well, kneeling on all fours, lifting one foot upwards and back down. So it's a bit like, you see me, it's so professional the way I'm running this course, isn't it? Like, there you go. That's hip lifts. There you go. So I've actually got this in, you've got the actual pictures in your manual, so don't worry, it's okay. And there's also leg presses. So lying on your side and lifting your hip towards the chest and pushing out by squeezing the pelvic floor muscles and buttocks. So there's this, okay. You'll see it, the pictures and how to do it in your manual as well. I've put loads of stuff in your manual, so hopefully you'll have access to that if you've got students that have specific issues or anything that you want to work with. And I've also written up and I've prepared quite a few yoga sequences for pregnancy for you that I'm going to post into your group. So you've got access to all of them as well. Okay, so leg lifts as well, lying on one side and lifting your leg, but not too high, and bringing it down slowly and involve only small movements. So just really gentle leg lifts is going to help with PGP as well, and doing pelvic floor exercises and cat-cow stretches and stability ball exercises as well. So how do you cope with pelvic pain during pregnancy? I've got handy tips in your manual that you can possibly use and make into handouts for your students if you want to. Does pelvic girdle pain affect your labor? No, it's not going to help, but you might be sore anyway. So making sure you're sitting upright or a kneeling position, or you're just not going to be lying down your back. So it's going to go away after a few weeks or months after the birth. It's not something you're always going to have. And mild pain might recur before periods, because your hormones are still settling themselves too. It might recur again in your subsequent pregnancy, but trying to strengthen the abdominal and pelvic floor muscles before getting pregnant again is going to help lessen the possibility of getting it. So there's just a few little frequently asked questions in your manual about it. So we're going to go a little bit further into placenta previa, and one of you guys have had that. It's Lynn, isn't it? And so yeah, so I'm going to speak about it, and then I'll see if there's anything that you can add to it, because you've experienced it. Instead of me speaking it from cerebrally, you've experienced it, and you might be able to guide us or help us. So what is placenta previa? And, you know, is it safe to teach a woman in your prenatal class with placenta previa? So the placenta is a key organ for pregnancy and attached to the baby via its umbilical cord, and it produces oxygen and nutrients for the baby. So ordinarily, the placenta is attached to the wall of the uterus, but in a condition called placenta previa, it can be located lower down the uterus, and it obstructs the cervix, and this obstruction can cause potential serious complications in late pregnancy and during birth. So it's actually a very common occurrence for many women in early pregnancy. And if it's detected by ultrasound, it can cause needless concern for many women. So this is due to the fact that 19 out of 20 women, the placenta will move out of the way as the uterus grows and the pregnancy progresses. So you can look at it like, imagine drawing a large spot in a balloon that is only partially filled. As you blow the balloon up to full size, the spot will have moved from its original position significantly, moving up and away from the opening of the balloon. So the uterus and the placenta behave in that kind of similar way as the baby grows. So in the majority of cases, the placenta will have moved out of the way by the 3rd trimester, which means that only 1 in 200 women will still have placenta previa by this time. It's even more rare that the placenta completely covers the opening of the uterus. Often the covering is only partial, which means it has a greater chance of moving out the way during pregnancy. So the 4 gradings of previa, so grade 1 is low-lying, the placenta is lying close to but not covering the cervical opening. Grade 2 is marginal, and the placenta is the edge of the cervical opening but does not cover it. Grade 3 is partial, the placenta partially covers the cervical opening. And then there's grade 4, which is full. The placenta fully covers the cervical opening. So how do you support women who come to your prenatal yoga class with this diagnosis? These women may be feeling quite nervous and may have been told they should be on bed rest. For a full placenta previa, a woman should avoid doing yoga asana. Instead, practices such as yoga nidra and visualizing the placenta moving out the way can be very powerful. The non-physical aspects of yoga can be very beneficial for these women, and because anxiety of feeling like a time bomb and the immobility of bed rest can increase the risk of conditions like diabetes and blood clots. So partial placenta previa, if it's partial or marginal previa and the woman is midway through her pregnancy, she can practice in class, but the teacher needs to work with her very carefully. So to accommodate these, we need to avoid or modify poses that create pelvic compression. So avoid wide-legged poses such as wide-legged hip and groin opening postures and squatting. So bringing the feet closer together and not bending the knees as deeply in the warrior poses, Virabhadrasana 1 and 2, or side angle pose, Parsvakonasana, will help to protect the pelvic area. And you could do triangle pose with legs closer together. I would say I've been teaching you guys to have your legs and train tracks and a little bit closer together anyway, just to keep everybody safe. You know, I think that's the main thing. Hindsight is a great thing, as I said. So while squats during pregnancy are highly beneficial in helping to open the pelvis and the hips, it can be a good idea to avoid unsupported squats in any pregnancy class, as some placenta previas are not yet diagnosed. So deep unsupported squats such as Malasana put pressure on the cervical opening. So have your students use 2 or 3 blocks under their bottom, so they're essentially sitting in their squat. Okay, so just be aware that, and then if you definitely have previa, they would avoid Malasana altogether, because you don't want it to embed deeper. So you can have them sitting on a folded blanket with knees parted and bent, and this still helps to open up the hips without placing undue pressure on the cervix. So Baddha Konasana, the seated groin stretch, is also best to be avoided. Alternatively, have them take an easy cross-legged pose while sitting on a blanket. So chairs can be beneficial for any pregnancy yoga practice, but even more so in supporting previa. So you could do, some of the chair work that we did. That would be chair yoga would probably be better, because you're actually supporting the cervix. So in summary, it can be helpful to remember that the adjustments for placenta previa are very similar to those with pelvic instability. It's important to check as to the grading of the previa and if the mama has approval of her caregiver to practice. So if you've got the all clear, it can help to show some of the modifications before the class begins. So Lynn, what type of placenta previa did you have?
Yeah, I had grade 4.
So you had the big one then.
Yeah. So when I had it, we were living in the Middle East. So I think the advice there is slightly different to what it would have been here, from gather. But to begin with, the doctor was scanning me every week to check everything, because I was bleeding, off and on, to make sure everything was okay. So she'd said initially you can swim and you can walk, and then eventually said you can just walk, and then eventually said nothing, just bed rest. But what I would say, because I've been thinking about this while I've been on this course, is conditions like this cause severe anxiety. So although some women wouldn't be able to do any asana, what would have been really, really helpful was other techniques to manage anxiety, breathing and meditation, just to relieve the anxiety.
Some of the pranayama as well, and yoga nidra.
Yeah, so it's probably still nice to welcome women to the class for that, or to offer one-to-one to help ease the anxiety, because there is a lot of anxiety, if you're having to have regular scans and there is bleeding, and of course when you read about what can happen,
oh my goodness,
terrible anxiety. And
then if you're in the Middle East and you're not around your family and your friends as well, it must have been quite scary too.
Yeah, and then the pressure of Liam getting bigger and bigger eventually led to hemorrhaging, and he was born at 28 weeks suddenly.
Oh my goodness.
And the hemorrhage started not because I was doing any sort of movement at all. I was sitting having a cup of tea, and I just felt it, and that was it. And so he was born 12 weeks early, and it was traumatic, really traumatic, because we were in the Middle East, and they didn't have any facilities at the hospital I'd been treated at for premature babies, and I was basically just told, come here, go and find somewhere else.
My God.
We did find a hospital that would treat me, and he was
my God
eventually, but yeah. So, and after that as well, I think anyone that's been through a traumatic birth, maybe the asanas, again, because it was a long recovery physically, the asanas are appropriate, but to help with the crippling anxiety, and
trauma, you would have a form of PTSD in a sense as well, definitely.
But now knowing, magic, you know, you can get from yoga, you know, the breathing and the meditation. It would have helped, you know, if only I'd been able to have, you know, had found yoga then, you know, that it,
Yeah.
you know, as yoga teachers, we can offer that support, you know, not just the asana.
And that's why I think you'd be such a wonderful pregnancy yoga teacher, and the fact that you have experienced so much with your pregnancies and the things that you've experienced, that you have so much empathy and compassion. But you find that I don't know how you're feeling it on the course, it does trigger things a little bit, because I know that when I did my pregnancy training, I'm like, oh, I didn't realize that, you know, I pushed it away a little bit because, yeah, I didn't have, you know, parents, or, you know, I didn't have any support system, and it'd been really traumatic, and you just got on with it. And it was like when we were speaking about it, you know, when you're doing the course, you're like, oh, and you to understand it, you're remembering your own experience, and there's a little bit of a, oh, the samskaras are coming up a little bit. So I don't know if that's been with you in this course as well.
Yeah, reflective as well, in that it's nice to know that you can then go on to support other people. And, you know,
Definitely.
I would never you know, tell my students what happened, because obviously that would scare them.
Yes.
But just
Yeah.
offer reassurance and support, you know, and just, you know, yeah, reassurance that, you know, that they'll be well looked after, and that, you know, everything will be okay, you know, and that look after themselves. And these are the tools that you can use to help yourself if you are feeling anxious or you are suffering from trauma. You know, the yoga can provide these tools to help you, you know.
I think that's the thing. It's knowing that there's a lot of, because it's young women as well. This isn't like my daughter's age group. They don't have this understanding. If things are out of control, they have this fear thing where it starts to unravel, and realizing that they're actually in control of their thoughts and their emotions and their feelings, and that's something that's really important. To be able to access that is going to give them some sort of sense of, you know, so I think that sense of enabling them to feel empowered in a way is something that's really important as well, isn't it?
Absolutely. And you feel empowered. You know, there's such a big connection between the physical and the mental. You know, I do believe, looking back, that a lot of the things that happened, and you know, the effect of the different things that happened, a lot of it started in my mind, you know, and the feeling of not being in control and being absolutely terrified, the fear, you know. So I think if I'd had tools and had felt more empowered, not the catalogue of events that did pan out, I don't think it would have happened in the way that it did.
But then it's part of your dharmic path, your life path, your karmic path, or, you know,
Yeah.
we're given these challenges are you know, challenges as crippling, as emotionally crippling they can be at the time. There are opportunities to evolve and to grow and to be able to help others. You know, I really do truly believe that, and it's like for when traumatic things happen, you have a choice in how you respond or how you deal with it, and I think you're showing how empowered you are now as a woman, and how you can help other women to really hold their own space, how that you didn't have that opportunity to do it, but you've got these tools and you're able to share it in such a strong and empathetic way that perhaps a woman that hasn't experienced that wouldn't have that you know, that amazing skill of deep empathy and compassion that you have. So yeah, definitely. So thank you for sharing, Lynn. Thank you, because it's really quite personal. So thank you, and it's really helps the others understand as well. You know, so really important stuff that. So we're going to speak about optimal fetal positioning now as well, which you've got stuff in your manual about that as well. So optimal fetal position, OFP, there's lots of acronyms. It's a theory developed by a midwife woman called Jean Sutton and Pauline Scott, who's an antenatal teacher, and they found that the mother's position and movement could influence the way her baby lay in the womb in the final weeks of pregnancy. So many difficult labours result from malpresentation, where the baby's position makes it more challenging for the head to move through the pelvis. So changing the way the baby is positioned could make birth easier for mother and child. So I worked right up until I was a full-time barmaid, and I was like a bar supervisor. So it was loads of part-timer students that stood around chatting, and I'd be the one going up and down changing the barrels and stuff like that. Being the sort of person I am, I just got on with it. So I was really heavily pregnant, only 20 years old, helping to run a bar. And because Levi, she was back to back, and because I was standing a lot and working a lot, she was over 2 weeks late, and it was just so difficult to get her out. And it was back to back. It's very painful. Now, if the same thing, if you'd known at the time, certain things about, but I think the more I'm doing standing work, the more necessary. She was turning the wrong way, and the more I'm standing around and doing all this hard work, the more she's nestling in there. So yeah, it's really important. I think the fact that we now know that there's certain things that might help with optimal fetal position. So the occiput anterior position is ideal for birth. It means that the baby is lined up so to fit through the pelvis as easily as possible. I was hoping, so I could have got the Grinch. I've thrown the Grinch out, actually. Could have got the Grinch to show you, but here we go. Your baby's not going to be wearing a raincoat. Well, hopefully. That would be really weird if your baby came out wearing a raincoat. So yeah, and so she's not fitting through, but you want the baby to have the face, you facing the spine. Okay, and that's the optimal position. So baby's head down, facing the mother's back, with his back on one side, ideally the left of the front of the mother's abdomen. So in this position, the baby's head is more easily flexed, and his chin is tucked into his chest, so the smallest part of his head will be applied to the cervix first. So the diameter of his head, which has to fit through the pelvis, is approximately 9.5 centimeters, and the circumference is approximately 27.5 centimeters. So the position is usually left occiput anterior, or LOA, and occasionally the baby may be right occiput anterior. So occiput anterior position is not ideal. So this means that the baby is still head down, but facing the mother's abdomen. So mothers of babies in the posterior position are more likely to have long and painful labors, and I'll vouch for that. So as the baby usually has to turn all the way around to face the back in order to be born. They can't fully flex their head in this position, and the diameter of the head, which has to enter the pelvis, is approximately 11.5 centimeters, circumference 35.5 centimeters. Levi came out looking like a boxer, honestly, poor wee soul. So the rate of posterior presentation has increased drastically in the last few decades, apparently due to changes in the way women use their bodies. Sitting in car seats and leaning back in comfortable sofas, together with less physical work, have combined to produce an increase in posterior presentations. So it was definitely not through lack of moving for me anyway, because I couldn't drive either, so I had to walk everywhere. So paying attention to one's posture in the last few weeks of pregnancy can help to reverse this. So we can help these ladies prevent having to go through some of these awful things. We're just going to help. We're not demi-goddesses here. We're just trying to help. It's better than not helping at all. So here's some day-to-day tips you can share with your students for OFP. So avoid positions which encourage the baby to face the mother's abdomen. So the main culprits are said to be relaxing back in armchairs, sitting in car seats, and leaning back, or anything where the knees are higher than the pelvis. So spend lots of time kneeling upright or sitting upright or on the hands and knees. So when sitting on a chair, ensure the knees are lower than the pelvis and the upper body is tilted slightly forwards. So watch TV while kneeling on the floor or over a beanbag or cushions, or sit in a dining chair. So try sitting on a dining chair facing or leaning on the back of the chair. Always makes me think of Neighbours. Remember Kylie Minogue and Jason Donovan? He used to always walk into a room and then turn a chair around and sit back. I don't know why, I always remember. Don't know why I said that. It was completely irrelevant to pregnancy yoga. Anyway, moving on. So use yoga positions while resting, reading, or watching TV. For example, cobbler's pose with a yoga block or cushion under the pelvis is useful as long as they don't have PGP. Okay, so avoid crossing the legs because this reduces the space at the front of the pelvis and can overstretch the sacral iliac area. For good positioning, the baby needs to have lots of space at the front of the pelvis. So sleep on the side, ideal on the left side, not on the back. And swimming with the abdomen face down is helpful for positioning babies in the OA position. Breaststroke will help with good positioning because the leg movements will help open the pelvis and settle the baby downwards. So breaststroke should be done with caution if the mother is prone to lower back or neck issues. So breech position. So has any of you guys had breech babies? No? No? Maria, have you? No? So there's no breech babies here. Oh, well then.
My last one was breached till quite late, but then I spent loads of time with my bottom in the air and he turned. So
oh,
it was one of those that got my bottom in the air every time, every possibility I could, either belly facing down or with my bottom on a whole load of cushions. So yeah.
Brilliant. So yeah, so sometimes the baby is in a bottom first or feet first position, and when the baby's in that position before birth, it's called breech birth, a breech baby. So many babies are breech early in pregnancy, but most of them turn to the head first position near the end of pregnancy. So babies who are born early are more likely to be breech, and if there's more than one baby in the uterus at a time, one or more of the babies may be breech. Abnormal levels of amniotic fluid around the baby may result in a breech birth. So ways of helping with optimal fetal positioning is things like working with you're not going to. So sorry, if you're in breech position, you want to work with cat-cow. You want to leave out strong standing positions. Because you don't want to encourage the baby. You want to think about softening, creating space in the pelvis, and you want to work with like wide-legged crescent lunges and stuff like that. So you want to. It's more about really creating space as well. So in your manual, I don't want to be reading loads of stuff to you. I'm trying to find which page you're in your manual. I've got I've put in some a sequence for it's not for optimal fetal positioning, but I've got postures, a little thing for placenta previa. So here we go. We've got yoga for optimal fetal positioning. Here we go. So I wrote this. So some of this stuff, there's a website that gives you a lot of information on optimal fetal positioning. It's called, I don't know if any of you have heard of it, it's called spinning babies. So a lot of people on the course that I was on had already trained with spinning babies. So they do, there's lots of stuff they do to do with preparing your baby, preparing for labor. So some poses that help with the prep of the pelvic area during pregnancy is so working with hip circles on all fours or standing, doing that. So and also Prasarita Padmottanasana, standing wide-legged forward bend with your hands on a chair or against the wall. So modern life has made the sacrum more vulnerable than it used to be. So that pose is going to help lengthen the hamstrings, which are attached to the iliac bone. Okay, so this is going to affect the sacroiliac joint function, which is essential for correct movement during birth. So add more height to the chair as necessary if you need to as well. And caution needs to be taken. Caution needs to be taken for if they've got PGP, so not to work with that one if they've got PGP. So wide-legged lunge as well is really good because it releases your psoas muscle, as I keep reiterating. So that helps with easing back pain, rebalances the pelvis, and also the psoas helps to release fear. So if psoas muscle has excessive tightness, it has a cascade of effect of unbalancing the whole of the pelvis and its associated muscles. So by releasing the psoas, we can help balance and correct the alignment of the uterus and the pelvis. So I have put in your manual a few yoga poses that can help to release the psoas. So you can, and it's got some pictures in it, so you can look at that. So we have got Malasana here, but as we said, remember we've said placenta previa, you're not going to do Malasana, and maybe just to keep everyone safe, you can get them to be supported on blocks. But if you know that the baby's going fine, like it's really going to help to get the baby in optimal fetal position. So when you squat, the muscles in the back, the glutes and the pelvic floor lengthen and relax, and it encourages blood supply to the whole of the pelvic area. Okay, so so spinningbabies.com gives you lots of information about babies' rotations during pregnancy, labor and birth. It's what babies' rotation, spinning babies. So it's a good website to go to. Okay. Yeah, so I've got I've given you given you in your manual lots of different exercises to work with for and we're going to speak about postnatal tomorrow. I think I've given you quite a lot today. What do you think? It's a bit of information overload, even though most of you had babies and stuff like that. Even if you've not had babies, you're probably aware of the anatomy of it. But it is a lot of information, And so if I keep start something new now and we fire into that, it's like I think I've given you optimal amount of information, and we're going to start afresh tomorrow. So let it all marinate with you tonight. I'll get your exam papers into your group tonight, and I'll be posting some class plans in for you as well, just to help you as well. I think that's everything for tonight. Yeah, I think I've got everything. Explained everything today. So tomorrow it's all about postnatal. Okay. I think we've done quite a bit there, but if you think today, you think tonight, wait a minute, she's not mentioned that, you look through the manual and there's something there that's just not, you need a bit more, as I said, let me know. Okay, so have a wonderful evening. Enjoy your evening. Saturday night, I might hoover, get really excited. Might have another chocolate button, you never know, go wild. So So have a wonderful evening. Thank you so much for joining me today. And thank you, Lynn, for sharing with us as well. Okay. Lots of love to you all. Okay, bye-bye.
Thank you, Lynn.
Bye.